Hello all, hope you're doing well today. Today we're finishing up chapter 18. This is part 3, and we're talking about clients who are pregnant. Here we go. When working as a personal trainer with women who are pregnant, it's important to prioritize their safety and well-being. Here are some guidelines to consider when training pregnant women. First, a consultation with their healthcare provider before you start any exercise program. Pregnant women should consult with their healthcare provider to ensure that exercise is safe for them and to discuss any specific guidelines or modifications that they might have for them. You should also familiarize yourself with the changes that occur during pregnancy and how they might impact exercise, especially depending upon the trimesters. So this includes understanding of hormonal changes, joint laxity, and cardiovascular adaptations. Each pregnant woman's fitness level, their health status, and stage of pregnancy can vary. Design exercise programs that are tailored to their specific needs, taking into consideration their fitness level, any pre-existing medical conditions, and any pregnancy-related complications. Personal trainers should address perceived barriers, such as lack of time, and raise awareness about the potential physical and mental benefits of exercise during pregnancy. Exercising during pregnancy offers numerous benefits for both the mother and the baby. Here are some of the benefits of exercising while pregnant. Improved overall fitness. Regular exercise helps maintain and improve cardiovascular fitness, muscular strength, and endurance, which can contribute to a healthier pregnancy and easier labor and delivery. Engaging in physical activity during pregnancy can help combat fatigue and boost energy levels, making it easier to manage daily tasks and responsibilities. And exercise can help alleviate common discomforts of pregnancy, such as back pain, constipation, bloating, and swelling. It also promotes better posture and muscular balance. Regular exercise supports healthy weight management during pregnancy. It helps prevent excessive weight gain and aids in postpartum weight loss. Enhanced mood and emotional well-being. Exercise releases endorphins, which are natural mood-boosting hormones. It can help reduce stress, anxiety, and symptoms of depression during pregnancy, promoting overall emotional well-being. And regular physical activity can help regulate sleep patterns and improve sleep quality during pregnancy. It also helps in reducing the risk of gestational diabetes. Exercise has been shown to lower the risk of developing gestational diabetes, a condition that can occur during pregnancy and affect both the mother and the baby. Better cardiovascular health. Aerobic exercise during pregnancy strengthens the heart and improves circulation, and benefiting both the mother and the developing baby. Health strengthening exercises help maintain muscle tone, improve posture, and support the joints, reducing the risk of musculoskeletal discomfort and injury. Staying active during pregnancy can contribute to a quicker recovery after childbirth, as it helps maintain muscle strength and endurance. It's important to note that every pregnancy is unique, and it's crucial for pregnant women to consult with their healthcare provider before starting or continuing an exercise program. And like I said, they can provide individualized recommendations and guidance based on the mother's health, fitness level, and any specific pregnancy-related considerations. In addition to the previously mentioned benefits, here are some other advantages of exercising during pregnancy. Exercise increases blood flow throughout the body, which can help reduce swelling in the extremities and lower the risk of varicose veins. It also can help enhance posture and body awareness. Particularly exercises that focus on core strength and posture can help improve body awareness and maintain proper alignment as the body undergoes changes during pregnancy. Exercise can boost the immune system by helping to protect against common illnesses and infections during pregnancy, and has been able to reduce risk of pregnancy complications. So regular exercise has been associated with a reduced risk of pregnancy complications such as preeclampsia and gestational hypertension. Exercise can help regulate digestion and prevent common gastrointestinal issues such as constipation, and indigestion, which are common during pregnancy. It also helps in strengthening the muscles needed for labor and delivery, such as the pelvic floor muscles, and can enhance endurance and stamina, making the process of childbirth more manageable. Exercise has also been shown to have potential benefits for fetal development, including improved placental function and a reduced risk of certain birth complications. Participating in prenatal exercise classes or activities can provide an opportunity for expectant mothers to connect with their growing baby and creating a sense of bonding and nurturing. Engaging in group exercise classes or activities specifically designed for pregnant women can offer a supportive and social environment, allowing mothers to connect with others who are going through similar experiences. Regular exercise during pregnancy promotes a healthy lifestyle that can have long-term benefits for both the mother and the child, such as reduced risk of chronic diseases and improved overall health. Healthy pregnant women should be encouraged to participate in daily physical activity throughout their pregnancy. During pregnancy, the cardiovascular system undergoes significant changes to support the growing fetus. When it comes to the cardiovascular response to exercise while pregnant, there are a few key factors to consider. The heart rate response to exercise is generally higher during pregnancy. It's common for pregnant women to experience an elevated resting heart rate and or a pronounced increase in heart rate during physical activity. This is primarily due to an increase in blood volume and hormonal changes. Stroke volume, which is the amount of blood pumped out of the heart with each heartbeat, increases during pregnancy as well. This helps meet the increased demands for oxygen and nutrients for both the mother and the fetus. During exercise, stroke volume may increase further, supporting the increased oxygen delivery to active muscles. Cardiac output, which is the volume of blood pumped by the heart per minute, also increases during pregnancy. This is mainly driven by the increased heart rate and stroke volume. During exercise, cardiac output may increase even more to meet the demands of the exercising muscles. Blood pressure tends to decrease during the first and second trimesters of pregnancy due to hormonal changes and increased blood vessel diameter. However, blood pressure may rise back to pre-pregnancy levels or slightly higher during the third trimester. Exercise can temporarily cause an increase in blood pressure during the activity, but it typically will return to normal levels immediately following. Pregnancy leads to an increase in blood volume to support the needs of the developing fetus. This increased blood volume enhances oxygen transport to the working muscles during exercise, aiding in overall performance. There's a venous return, the return of the blood to the heart that can be affected during exercise due to the compression of veins by the growing uterus. This may result in some discomfort, particularly when exercising in a supine position or where they're lying flat on their back. It's generally recommended to avoid or limit exercises in this position, especially during the later stages of pregnancy, like the third trimester. The respiratory system undergoes various changes as well to accommodate the increased oxygen needs of both the mother and the developing fetus. When it comes to the respiratory response to exercise while pregnant, here are some key points to consider. An increased oxygen consumption. As physical activity increases, oxygen consumption also increases to meet the demands of the exercising muscles. Pregnant women experience an increase in oxygen consumption due to the metabolic demands of pregnancy. During exercise, the respiratory system works to supply the necessary oxygen to the body. Ventilation, which refers to the volume of air breathed in and out per minute, is elevated during pregnancy, primarily due to increased oxygen demand and the need to eliminate carbon dioxide. During exercise, ventilation increases even further to meet the increased oxygen demand and remove waste products generated by the working muscles. Pregnant women may experience changes in breathing patterns during exercise. This can include a sensation of shortness of breath or a feeling of increased effort due to the growing uterus restricting diaphragmatic movement. As pregnancy progresses, women may naturally adopt a more thoracic breathing pattern upon the chest, using the chest and ribs more than the diaphragm. The exchange of oxygen and carbon dioxide in the lungs is crucial for maintaining proper blood gas levels. During exercise, the respiratory system facilitates the efficient exchange of these gases. The increased ventilation and perfusion or blood flow in the lungs support effective gas exchange, ensuring an adequate oxygen supply to the body and the removal of carbon dioxide. While pregnancy may cause some changes in lung function, such as decreased lung volumes and altered lung mechanics, the respiratory system still adapts to meet the increased oxygen demands. The changes in lung function are generally well tolerated during exercise, and the respiratory system can adequately support physical activity. It's important to note that each woman's cardiovascular and respiratory response to exercise during pregnancy can vary based on factors such as pre-pregnancy fitness level, their gestational age, and individual physiological differences. It is recommended for pregnant women to consult with their healthcare provider to determine appropriate exercise intensity, duration, and type based on their specific circumstances and any potential risks or contraindications. Regular prenatal checkups and monitoring are essential to ensure the well-being of both mom and the baby during exercise. As the uterus and breast become larger during pregnancy, a woman's center of mass changes during pregnancy. A woman's body undergoes various mechanical and physiological changes to accommodate the growing fetus. These changes can impact posture, joint stability, balance, and overall comfort during exercise. As a personal trainer, it's important to be aware of these changes and make appropriate accommodations to ensure the safety and well-being of pregnant clients. Here are some considerations for accommodating mechanical and physiological changes during pregnancy. As the pregnancy progresses, a woman's center of gravity shifts forward due to the growing abdomen. This can lead to an increased curvature in the lower back, or called lordosis, and rounded shoulders. Encourage your pregnant clients to maintain proper posture during exercise, focusing on alignment and avoiding excessive arching of the back. Hormonal changes during pregnancy can cause increased joint laxity and looseness in the ligaments. This can affect joint stability and increase the risk of injury. Avoid exercises that involve excessive joint stress or quick, jerky movements. Instead, focus on controlled range of motion exercises. As the pregnancy progresses, changes in weight distribution can affect balance and stability. Incorporate exercises that promote balance and stability, such as single leg exercises or exercises using stability balls or balance boards. Use caution with exercises that require a high level of balance or coordination. The growing uterus can limit diaphragmatic movement and affect your breathing patterns, so encourage your clients to maintain a comfortable breathing pattern during exercise and avoid exercises that may cause breathlessness or compromise their ability to breathe comfortably. In the second and third trimesters, avoid or limit exercises performed in a supine position, lying flat on the back for extended periods. This position can compress the vena cava, reducing blood flow to the heart and potentially causing dizziness or shortness of breath. Modify exercise to be performed in an inclined position or a side-lying position instead. And while it's important to strengthen the core during pregnancy, certain traditional core exercises may need to be modified. Avoid exercises that involve lying flat on the back or placing excessive strain on the abdominal muscles, such as bull sit-ups or crunches. Instead, focus on exercises that promote core stability and engage the deep abdominal muscles, such as pelvic tilts or modified planks. And encourage open communication with your pregnant client and listen to their feedback. Each woman's experience during pregnancy can vary, and it's important to respect their comfort level and adjust exercises accordingly. Pay attention to any discomfort or pain reported during exercise and modify or substitute exercises as needed. Pregnant women may experience increased fatigue and may need more frequent breaks during exercise. Encourage your clients to stay hydrated and listen to their bodies. It's important to avoid overheating and rest as needed. And like I said, each woman's pregnancy is unique, so it's crucial to individualize workouts based on their specific needs, fitness level, and any medical considerations. Personal trainers should include pelvic floor muscle training because these muscles provide the basis for postural support and reduce the risk of urinary incontinence. The body undergoes metabolic and thermoregulatory changes as well that can impact the response to exercise. Here are some key points to consider. The metabolic response, so energy expenditure. Engaging in physical activity increases energy expenditure as the body needs to provide energy for muscular work. The metabolic response to exercise during pregnancy is similar to that of non-pregnant individuals, but the total energy expenditure is higher due to the increased metabolic demands of pregnancy. During exercise, the body primarily uses carbohydrates as fuel source to provide energy for muscular contractions. However, fat metabolism also plays a role, particularly during low-intensity activities. Pregnant women can effectively use both carbohydrates and fats as energy sources during exercise. Hormonal changes during pregnancy, such as elevated levels of estrogen and progesterone, can impact metabolism. These hormones influence glucose and lipid metabolism, but they do not significantly alter the overall metabolic response to exercise. Pregnancy affects thermoregulation as the body's core temperature can increase more easily during exercise. This is due to increased metabolic heat production, hormonal changes, and the presence of a growing fetus. It's important to monitor core body temperature during exercise to prevent overheating and ensure the safety of the mother and the baby. Pregnant women may have a higher sweat rate during exercise as the body works to dissipate heat and regulate body temperature. Adequate hydration is crucial to maintain fluid balance and prevent dehydration. Pregnancy can affect heat dissipation mechanisms such as blood flow and sweating. The body's ability to efficiently dissipate heat through increased blood flow to the skin and sweating may be compromised to some extent. This can make pregnant women more susceptible to overheating and heat-related complications during intense or prolonged exercise, particularly in hot and humid environments. While exercising during pregnancy is generally considered safe and beneficial for most women, it's important to pay attention to warning signs that may indicate the need to discontinue or modify exercise. If any of the following warning signs occur during exercise while pregnant, it's recommended to stop exercising and consult with a healthcare provider. Any vaginal bleeding during pregnancy, including spotting or heavy bleeding, should be taken seriously. It may be a sign of a potential complication, and exercise should be halted immediately. Intense or persistent abdominal pain that is not relieved by rest should not be ignored. This could be a sign of a serious issue, such as placental abruption or preterm labor, and exercise should be stopped. Feeling lightheaded, dizzy, or experiencing fainting spells during exercise can be a sign of inadequate blood flow to the brain. It may indicate dehydration, low blood pressure, or other underlying condition. Cease exercise, rest, and seek medical advice. While mild breathlessness during exercise is normal, severe or sudden shortness of breath, chest pain, or difficulty breathing could indicate a problem. These symptoms may be a sign of a cardiovascular or respiratory issue, and exercise should be discontinued. Sudden or severe calf pain, swelling, or redness could indicate a blood clot in the leg or deep vein thrombosis. Cease exercise and consult a healthcare professional immediately. Persistent severe headaches or changes in vision, such as blurred vision or seeing spots, should be addressed promptly. These symptoms may be associated with high blood pressure or other conditions that require medical condition. Fluid leakage. If there's a sudden gush or continuous leakage of fluid from the vagina, it may indicate ruptured membranes or water breaking. Stop exercise and contact a healthcare provider. If you're feeling extremely fatigued or exhausted beyond what is typical during exercise, it may be a sign that the body is under excessive stress. Listen to your client and what they're telling you. Have them rest and seek medical advice if the fatigue persists. If you notice a significant decrease in fetal movement during or after exercise, it's important to stop exercising and monitor the baby's movements. Contact your healthcare provider if you have concerns. It's also important to make sure to obtain medical clearance before beginning or modifying an exercise program. They can evaluate your client's overall health, medical history, and any specific considerations to provide personalized recommendations. Always opt for low-impact exercises that minimize stress on joints and reduce the risk of falls or injuries, especially in the later stages of pregnancy, the second and third trimester. Examples include walking, swimming, stationary cycling, prenatal yoga, and low-impact aerobics. Avoid activities with a high risk of abdominal trauma or falls, such as contact sports or activities with a risk of falling. Always begin with a warm-up session to prepare the body for exercise and increase blood flow to the muscles. Similarly, you want to finish each exercise session with a cool-down period to gradually reduce the heart rate and prevent dizziness. Pay attention to your client's perceived exertion and aim for moderate intensity exercise. It should feel challenging but not overly strenuous. Avoid pushing to a maximum exertion level and ensure that they can maintain a conversation during exercise. Make sure they are drinking plenty of fluids before, during, and after exercise to prevent dehydration. Proper dehydration is important for the mother's well-being and the baby's development. And be cautious about overheating during exercise. Avoid exercising in hot and humid environments. Make sure that they dress in lightweight and breathable clothing and use fans or air conditioning to stay cool. Pay attention to signs of overheating, such as dizziness, nausea, or excessive sweating. And take appropriate breaks or have them stop exercise if necessary. You want to make sure to adapt exercise to accommodate the changes in their body and avoid putting excessive stress on their joints and abdominal muscles. So modify positions and use support such as pillows or props for comfort and stability. And make sure you're incorporating regular pelvic floor exercises, also known as Kegel exercises, to strengthen the muscles that support the bladder, uterus, and bowel. These exercises can be done throughout pregnancy and can help with labor and postpartum recovery. When pregnant, it's generally recommended to engage in a variety of low-impact aerobic activities and exercises that support overall strength, flexibility, and relaxation. Walking is a low-impact cardiovascular exercise that can be easily incorporated into your client's daily routine. It helps improve cardiovascular fitness, maintain healthy weight, and boost mood. Swimming and water aerobics are excellent options during pregnancy. The buoyancy of water reduces stress on joints and provides resistance for muscle toning. It also helps relieve swelling and discomfort. Prenatal yoga focuses on gentle stretching, relaxation, and breathing exercises. It helps improve flexibility, strength, and balance while also promoting relaxation and reducing stress. Prenatal Pilates focuses on core strength, stability, and overall body conditioning. Modified exercises help improve posture, flexibility, and muscle tone without placing excessive stress on the abdomen. Cycling on a stationary bike is a low-impact aerobic exercise that provides cardiovascular benefits while minimizing stress on joints. You want to make sure that they adjust the resistance and intensity according to their comfort level. Participating in low-impact aerobic exercises or following instructional videos designed specifically for pregnant women can help maintain cardiovascular fitness and overall stamina. Incorporating light resistance training exercise can help maintain muscle tone and strength. Focus on exercises that target major muscle groups using lighter weights and higher repetitions, so more of endurance, muscular endurance type activities. Engage in gentle stretching exercise to improve flexibility, relieve muscle tension, and promote relaxation. And be mindful of avoiding excessive or deep stretches that strain ligaments due to pregnancy-related hormonal changes. Activities such as meditation, deep breathing exercises, and relaxation techniques can help reduce stress, promote mindfulness, and enhance overall well-being during pregnancy. The duration of exercise during pregnancy can vary depending on individual circumstances, including their fitness level, overall health, and any specific recommendations from their healthcare provider. In general, it's recommended to aim for at least 150 minutes of moderate intensity aerobic exercise spread throughout the week. So engage in aerobic activities that are going to help them to raise their heart rate and break a sweat, but still allow them to carry on a conversation comfortably. It's generally recommended to spread the exercise duration over multiple sessions throughout the week rather than attempting to complete it all in 1 or 2 sessions. This approach helps with better energy management and reduces the risk of overexertion. Exercise should not continue past the point of fatigue and should never reach exhaustive levels, but should be performed at a comfortable level at which you can maintain a conversation. You also want to be very careful that they are avoiding straining or stretching to the point of discomfort. And as we've mentioned, exercise in the supine position should be avoided after the first trimester. Some exercises to avoid during pregnancy. Again, although exercise is recommended for uncomplicated pregnancies, you should avoid certain exercises, such as exercises that involve lying flat on the back for prolonged periods, particularly after 16 weeks. The weight of the baby can press on the main blood vessels that brings blood back to the heart and can cause them to feel faint. High impact sports in which there's a risk of falling or injuring the abdomen, such as football, horse riding, skiing, etc. And lifting heavy weights or using machines that require wearing a belt around the waist. I will say that there have been some changes that you can lift weights, but you do have to be careful in how much you lift. Especially for those that have been lifting weights, it's okay to continue. You just want to be very careful about the amount of weight that you're lifting and, again, the type of exercise that you're doing. Body temperature regulation during exercise is an important consideration during pregnancy. Elevated body temperature, especially to the point of overheating, can potentially pose risks to the developing fetus. Here are some points to keep in mind. Overheating, particularly in the first trimester, is associated with an increased risk of certain birth defects. To prevent overheating, it's important to exercise in a cool environment, stay well hydrated, and avoid exercising in hot and humid conditions. Dress appropriately. Wear lightweight, breathable clothing that allows for adequate ventilation and sweat evaporation. Opt for moisture-wicking fabrics that help your client to keep cool and dry during exercise. Make sure they are drinking plenty of fluids before, during, and after exercise to maintain proper hydration. Dehydration can make it more challenging for your body to regulate temperature. Aim to drink water or other hydrating beverages regularly throughout the day and listen to their body's thirst cues. Consider exercising during the cooler parts of the day, such as early morning or evening, to minimize exposure to high temperatures. Indoor exercise options with air conditioning or fans can also help regulate body temperature. And make sure you're paying attention to their body's cues and reduce the intensity or duration of exercise if they start to feel excessively hot or fatigued. Be mindful of the signs of overheating, such as dizziness, nausea, excessive sweating, or rapid heartbeat, and take appropriate breaks or stop exercising if necessary. While it's challenging to directly measure core body temperature during exercise, be aware of how you feel. If they are feeling symptoms of overheating or discomfort, take immediate steps to cool down by resting in a shaded or air-conditioned area. Remove excessive layers of clothing and hydrate. Playing sports during pregnancy can be a personal decision should be approached with caution and guidance from your healthcare provider. While some sports may need to be modified or avoided altogether, many pregnant women can safely engage in certain sport activities. Opt for low-impact sports that are less likely to cause trauma or excessive stress on their joints and abdomen. Examples include swimming, walking, prenatal yoga, stationary cycling, and low-impact aerobics. These activities help maintain cardiovascular fitness and promote overall well-being without placing excessive strain on the body. High-impact or contact sports such as basketball, soccer, hockey, or martial arts pose a higher risk of falls, collisions, or abdominal trauma. It's generally recommended to avoid or modify these sports to minimize the risk of injury to you and your baby. For example, switching to non-contact variations or modified rules, or engaging in recreational versions that prioritize safety. You want to make sure that you're paying attention to how your client feels during sports activities. As pregnancy progresses, their body undergoes changes that may impact their balance, joint stability, and overall comfort. Modify or discontinue any activity that causes pain, discomfort, shortness of breath, dizziness, or excess fatigue. And always make sure they're prioritizing their well-being and their babies. Make sure they're wearing appropriate and comfortable athletic attire that provides proper support to their changing body. You want to make sure they're investing in a supportive sports bra, comfortable shoes with good arch support, and clothing that allows for ease of movement and breathability. And again, proper hydration is important during physical activity, especially when pregnant. So make sure they're drinking plenty of water before, during, and after. Exercise in a cool, well-vented environment and take breaks as needed to avoid overheating. And just be mindful of balance and joint changes. As their pregnancy progresses, their center of gravity is going to shift and hormonal changes may affect joint stability. Be cautious of activities that require sudden changes in direction or rapid movement that may increase the risk of fall or joint injuries. Pregnancy is not necessarily the time for them to push themselves to the limits of their physical abilities. Avoid intensive or exhaustive workouts and make sure they're listening to their body's cues for rest and recovery, and modify the intensity, duration, and frequency of sport activities according to their comfort level and their healthcare provider's recommendations. Participating prenatal exercise classes or programs led by qualified instructors can provide guidance and support tailored to the needs of pregnant women. These classes often incorporate safe and appropriate exercises specific to each trimester. After giving birth, it's important to gradually resume exercise and prioritize your client's postpartum recovery. Always, before starting or returning to exercise postpartum, make sure that they consult with their healthcare provider. They can assess their recovery, any specific considerations or complications, and provide personalized recommendations based on individual circumstances. Make sure to begin with gentle exercises and gradually increase intensity and duration and frequency over time. Your body's undergone significant changes during pregnancy and childbirth, so it's important that you make sure that you're giving them time to heal and rebuild strength. Core and pelvic floor muscles can be weakened during pregnancy and childbirth, so incorporating exercises that specifically target these areas, such as pelvic floor exercises, the Kegels, and gentle core strength exercises to help regain strength and stability. Make sure to consider working with pelvic floor physical therapists possibly to assess and even help rehabilitate those pelvic floor muscles, and guiding you through exercise and techniques to promote proper healing and function. And diastasis recti is a condition where the abdominal muscles separate during pregnancy. If your client has this, they should work with a healthcare provider or specialized postpartum fitness professional to perform appropriate exercises that help restore proper alignment and promote healing of the abdominal muscles. If your client is breastfeeding, it's important to wear a supportive bra and consider feeding or pumping before exercise to reduce breast discomfort and the risk of milk leakage. Make sure they're hydrating well before and during and after exercise to maintain milk supply and support overall hydration. And make sure they're paying attention to how their body feels during and after exercise. If they experience pain, discomfort, excessive fatigue, or any other concerning symptoms, modify or stop the activity. Their body's still in recovery, so it's important to avoid overexertion. Choose low impact activities initially, such as walking, swimming, stationary cycling, or postpartum specific exercise classes. These activities are generally easier on their joints and allow for gradual reconditioning of their body. And be mindful of their posture and body mechanics during exercise and everyday activities. Maintain good posture and using proper body mechanics while lifting, carrying, or performing daily tasks that can help prevent strain on the muscles and joints. And adequate rest and recovery are crucial during the postpartum period. Making sure they're getting enough sleep and listening to their body's signals for rest, and considering incorporating some relaxation techniques such as gentle stretching or mindful exercises to promote overall well-being. Every postpartum journey is unique, and their exercise routine should be tailored to their specific needs and recovery. This is the conclusion of chapter 18. And so really important to understand that regular participation in physical activity can offer observable health and fitness benefits to pre-adolescent youth, older adults, and pregnant women. However, because each of these special populations has particular characteristics, you should be cognizant of exercise recommendations that address their individual needs and abilities. And in many cases, exercise modifications will be needed to enhance the safety, efficacy, and enjoyment of exercise programs for these clients. And that is all that I have for you today. I look forward to talking with you again. Have a great day.